All right, this is Dr. Gutierrez. I'm going to give you a brief presentation on autism and also communication disorders as well. So again, this one is about autism and speech and language disorders. So we'll go ahead and start with autism. So autism spectrum disorders are actually also known as pervasive developmental disorders that primarily affect behavior, affects language, and it affects social interactions between children, between adults, a lot of times, lack of eye contact, along with a lot of other characteristics as well, where they just don't have the pragmatic skills to interact with others, to communicate well. And a lot of times there's challenging behaviors, and there's a spectrum really, in that, there's some cases that are really severe where there's students that have autism that are nonverbal, and then there's students that are verbal, and then there's everything in between as far as being able to understand things and express things as well. So those are some basic concepts about autism that I think it's important to kind of understand. So some common difficulties, especially with students with autism, like I mentioned, either verbal and nonverbal communication, the social interactions, not getting along with others, sometimes sharing, being very upset when something is taken away, or these are things that I've seen in my classes that I've taught with students with autism. And it can affect their home life as well, their play activities, they may exhibit some typical characteristics as well, but this isn't always the same in every student, and it's different. Repeated body movements. Um, Sometimes you see a lot of the children, with their hands, they kind of like grasp them multiple times in a routine movement. Unusual response, and that's with their fingers. Unusual responses to people, attachments to objects, and then again, resistance in changes in routine. So if you try to take something away or change something, they get very upset about that. So those are some basic concepts on autism. We do have various interventions. We have one known as TEACH, which is basically TEACCH, which is an acronym for Treatment and Education of Autistic and Related Communication Handicapped Children. And it basically includes parents as co-therapists. We have another one known as PECS, which is the Picture Exchange Communication System. And this one is really considered low tech. So in assistive technology, we have low tech, mid tech, and high tech. And this is considered actually low tech, and it's a way for parents, teachers, and the students to communicate. And they put something usually around their neck with a little board, and it's a picture exchange communication system. They can even have it on their desk, and it's a way to communicate and also for them to understand and for you to understand what they're trying to say. Inclusion. A lot of times we educate students with autism, we fully include them in the general education environment, or at least in the least restrictive environment as possible. Um, so that's very, very important. Social stories is another very big intervention and instructional strategy that is very helpful with students with autism, and ensuring that you're instructing with various social stories, social scripts. That really does help students with autism take the perspective of another person. And then there's also the Greenspan intervention, which is also known as floor time, developmental individual difference, relationship based, and it targets emotional development. Um, it targets the social emotional development model. There's also the discrete trial that I forgot to mention as well, and just other different types of methods, the natural environment as well, um, play therapy as well, that is used with students with autism as well. In regards to communication disorders, so communication disorders can be broken into two major areas. One is known as speech disorders, and then the other one is known as language disorders. So we'll go ahead and start with speech disorders first. With speech disorders, you have something known as various components, issues with voice. They could have issues with articulation, so with stuttering, issues with fluency as well. Actually, that one's more with stuttering. And issues with language disorder, that really refers to more of the understanding of language. So the comprehension piece of language. So speech disorders, so think of communication disorders as one huge umbrella, and then under communication disorders you have speech disorders, and then you have language disorders. Speech disorders have to do, again, like what you hear, right, from the other person, which is the voice, the articulation, the fluency, and then language disorders have to do with the impairment of comprehension and understanding language. So in breaking down speech disorders, because that was the first part, we have, again, fluency disorders, articulation disorders, and voice disorders. So fluency disorder refers to the pattern of the rate and flow of a person's speech. So many young children, they exhibit uh, disfluencies. They typically disappear after age 5, around there. And then normal speech patterns include some interruptions in speech flow. So that's important to know as well. So we have to show them through choral reading, a method where we read all together, and then we have actually where we read a phrase and then they read a phrase, or through oral close method where we make sure that they're reading a specific word when we stop at that word, or also, so there's the oral close method, there is the choral read method, and just repeating and showing them where we take pauses is very, very important as well. We also have language disorders. And like I mentioned, with language disorders, that has to do with the impairment of understanding language. So there are two modes of communication, and this is how we communicate as humans. One is through receptive language, which involves receiving and decoding and interpreting language. For example, reading and listening is an example of receptive language. We are receiving information, we're also decoding information, and we're also interpreting information anytime that we read and also anytime that we listen as well. Expressive language is the second component of language disorders, and this involves encoding or the production of a message. So typically this is writing, okay, so being able to write information that's coherent and being able to speak in a coherent manner as well. And there is a sequence of normal language development that many speech language pathologists actually follow, and they look at those characteristics according to the child's age level. So that's very important to ask your speech and language pathologist either at the school or through a medical setting, or your pediatrician as well can also refer you to that specialist, and usually they have those age level charts as well. Some classroom strategies that we can use for students with communication disorders and also students with autism include the following. So number one, we want to make sure that we improve the comprehension skills in the classroom. So we show them a variety of comprehension skills and how to assess their understanding of when to stop, when they're reading, of when to understand and how to understand nonverbal communication. Making sure that we're giving students opportunities for facilitative play and role playing is also very important. And just the whole role playing therapy model where, in the natural environment where you're having them play and then teaching them, while they're playing, is also very important. You want to also encourage students to talk with their teachers and peers, and this is where the academic language is very important. And using academic vocabulary is also important, speaking in complete sentences as well. You want to use the naturalistic techniques and also simulated real life activities to increase language use. So that goes again to the role playing aspect and making sure that they're able to understand that, so that way when they're out in the real world, they're able to communicate better. And then also, while you're doing that as well and you're teaching them the academic language, you also want to encourage and give them opportunities for conversational skills through story reading as well, and that's really important. And then you also want to provide explicit direct instruction. So depending on whatever skill it is that you're trying to teach them, if it's a fluency skill, if it's an articulation skill, or if it's a way of how to interact, well, you want to make sure that you teach that skill. And that's known as explicit direct instruction, where it's the I do part where you actually show them, okay, then it's the we do, and then you do it together with the student, and then the you do. So you have the student actually practice it. So that explicit direct instruction model is very, very important in this aspect when teaching autism and also students with communication disorders. And some best practices with inclusive models. In years past, pull-out models were used for students requiring speech and language services, and now a lot of times what we're actually seeing now is that the speech and language pathologist is actually in the general education classroom or providing some of those services in the general education classroom. So sometimes that's happening. Not too often, but it's going there. Also, collaboration between classroom teachers and the speech and language pathologists is essential, and you're starting to see that more often. More of the speech and language pathologist training programs are encouraging new speech and language pathologists to interact with various IEP team members and really show them how to use various strategies and interventions, because it's important for the kids to use those strategies in the classroom, not just in that setting with the speech and language pathologist, and also not just at home. So they have to use it in pretty much in all of their settings where they're at with all various types of stakeholders. It's really, really important that they get that practice.